Welcome back to my YouTube channel Healthy Lifestyle with Saira. In today's video, I am going to talk about mouth ulcer, its causes, symptoms, and treatment options. First of all, I will talk about what is a mouth ulcer. A mouth ulcer is a sore that appears anywhere inside your mouth. These sores are usually red, yellow, or white, and you might have one or several. You can get mouth ulcers on your gums, tongue, roof of your mouth, inner cheeks, and inner lips. These sores are often painful and can make eating, drinking, and speaking uncomfortable. Mouth ulcers can be alarming, however, they are not sexually transmitted infections, and you can't get or spread them from kissing or sharing food or drinks. An ulcer that won't heal may be a sign of mouth cancer. In most cases, mouth ulcers are harmless and resolve by themselves within 10 to 15 days without the need for treatment. Aside from any pain and discomfort, mouth ulcers are usually harmless. But some types of mouth sores could point to underlying health conditions like viruses, autoimmune diseases, or gastrointestinal issues. Now I am going to discuss about the symptoms of mouth ulcers. The symptoms of mouth ulcers depend on the cause, but may include one or more painful sores on part of the mucous membrane lining the mouth, swollen and red mucous membrane around the sores, problems with chewing or tooth brushing because of the tenderness, irritation of the sores by salty, spicy, or sour foods, irritation of the sores by dentures, orthodontic aligners, or mouth splints. Causes of mouth ulcers. Mouth ulcers can be caused by a wide range of factors, including accidentally biting the inside of your cheek, injury from a toothbrush, constant rubbing against the misaligned or sharp broken teeth, constant rubbing against dentures or braces, burns from eating hot foods, irritation from storing antiseptics such as a mouthwash, viral infections such as herpes simplex viral infection, which is a cold sore virus, reaction to certain medicines, skin rashes in the mouth, autoimmune diseases, underlying vitamin B2, folate or iron deficiency, underlying gastrointestinal disease such as Crohn's disease or celiac disease, mouth cancer. Ulcers may become worse during the periods of stress, illness, or extreme fatigue. Now the question is, are mouth ulcers cancerous? Mouth cancer and mouth ulcers are distinctive in their symptoms. However, new or persistent ulcers require checking. There are some fundamental differences between mouth ulcers and what might be cancer. Mouth ulcers are often painful, whereas mouth cancer is not. Mouth ulcers will clear up in about 2 weeks, whereas mouth cancer will not go away and will often spread. Mouth cancer patches may be rough, hard, and not easy to scrape off. Mouth cancer is often a mix of red and white areas or large white areas that appear on the tongue, the back of the mouth, the gum, or on the cheeks. Mouth cancer is often linked to heavy drinking or tobacco use. Now I am going to talk about the types of mouth ulcers. Standard ulcers appear on the inner cheeks and last for about 1 week. Most are harmless and clear up with no medical intervention. There are 3 main types of mouth ulcers. These include: the first one is herpetiform ulceration. Herpetiform ulcers are a subtype of mputh ulcers and get their name because they resemble the sores associated with herpes. Unlike herpes, herpetiform ulcer is not contagious. Herpetiform ulcer recur very quickly, and it may appear that the condition never gets better. Second type of ulcer is minor ulcers. This type can range in size from about 2 millimeters up to 8 millimeters across. These ulcers typically take up to 2 weeks to get better and will cause minor pain. Third type of ulcer is major ulcers. Bigger than minor ulcers, major ulcers are often irregular in shape, may be raised, and penetrate deeper into the tissue than minor ulcers. They can take several weeks to go away and are likely to leave scar tissue when they clear. Now I am going to discuss about the treatment options for mouth ulcers. As I already told you that most mouth ulcers are usually harmless and resolve by themselves within 10 to 14 days. Other types of mouth ulcers such as a fetus variety or those caused by herpes simplex infections or skin rashes in the mouth need topical treatment such as a mouthwash, ointment or gel. It's not possible to speed up the recovery of ulcers, but the symptoms can be managed and the risk of complications reduced. Treatment options for mouth ulcers include: avoid spicy, salty, or sour foods until the ulcers heal. Drink plenty of fluids. Keep your mouth clean. Apply antiseptic gel to the ulcers. Rinse your mouth out with warm, slightly salty water, keeping the rinse in your mouth for up to 4 minutes at a time. Repeat 4 times daily. Use an alcohol-free medicated, preferably containing chlorhexidine gluconate mouthwash twice daily. Use a topical alcohol-free steroid mouthwash or ointment. This is generally prescribed by your dentist or oral medicine specialist. How to prevent mouth ulcers? You can take these steps to help reduce the occurrence of mouth ulcers. Avoid foods that irritate your mouth. That includes acidic fruits, nuts, chips, and anything spicy. Instead, choose whole grain and non-acidic fruits and vegetables. Eat a well-balanced diet and consider taking a daily multivitamin. Try to avoid talking while you are chewing your food to reduce accidental bites. Reduce your stress. Maintain good oral hygiene by flossing daily and brushing after meals. Avoid hard bristled toothbrushes and mouthwashes containing sodium lauryl sulfates or alcohol. Ask your dentist to give you wax to cover dental or orthodontic mouth devices that have sharp edges. Get adequate sleep and rest. This will not only prevent mouth ulcers but a host of other illnesses as well. This is all about mouth ulcers. If you like my video, please subscribe my channel. Goodbye.